let's get started. First of all, on behalf of myMatrixx and our organization, I want to really thank everyone for participating in the transportation safety panel discussion. And of course, we can't have anything in 2020 without it, including COVID. So we are pleased to bring together a great panel that's going to be moderated by Dr. David Dietz. And Dr. Dietz has been in a national medical director for Liberty Insurance for over 13 years and includes a variety of other roles as medical director in medical software and information industries. He'll be leading our discussion today. We have Denise Algier, and really want to thank Denise's organization and her 300,000 workers, essential workers, who help provide food and other necessities, for Albertsons companies. She is the Director of Risk Initiatives and National Medical Director for Albertsons. Larry Bird, who's going to provide our sleep expertise from Knox Health, and Lori Ilgenfritz, who is the Transportation Practice Lead for Gallagher Bassett, and has been really focused on best practices and has over 30 years of experience with YRC worldwide prior to joining Gallagher Bassett. We have Dr. Anne Marie Puricelli, who is the National Medical Director for Transportation at Concentra, and in addition to practicing occupational medicine since 1991, she has a JD from the St. Louis University School of Law. We have Tammy Reed joining us, more than 30 years work comp experience, working now as a locked-in claims consultant and focused on the transportation segment, working both in transportation and staffing industries. A good friend, Ann Schnur, who I can say, because our industry sometimes does not really embrace innovation. Ann is one of the true innovators of our industry, and love thinking outside the box with Ann. She runs Concentra's telemedicine practice, is also a board member of the Alliance Women in Workers' Compensation. We have Dr. Richard Strip, forensic clinical toxicologist and chief scientific officer for Cordon Health, has published dozens of articles and books and provided expert opinions on thousands of toxicology cases. And David Vittoria, who's an addiction expert, trauma-trained therapist, grief recovery specialist. And last but not least, and only because his last name starts with a W, it's Phil Walls, who is myMatrixx Chief Clinical Officer and pharmacist. He has 25 years of PBM expertise and was one of the first, I think, 15 employees at myMatrixx, and has been a distinguished speaker. So with that, I'm going to turn it over to Dr. David Dietz to start the panel discussion. Dr. Dietz?
Thanks, Dave. My role as moderator here, since we have a lot of great expertise on this panel, is really going to be to mostly shut up and stay out of the way, which, as some of you know, is kind of out of character for me, but I'll do my best. So I will be asking some questions, and for those of you who are in the audience, we're going to keep everybody muted just to manage the technology and not have any extraneous audio. So if you have questions, please type them in via chat, and I will get them, and we will try to direct them to the appropriate panelist. As you can see from the agenda, what we're going to do is talk generally about work comp, and then about the specifics of transportation and some of the issues there, and then have kind of a general discussion about where we're headed in 2021 and beyond in terms of problems with injured transportation workers. And then we have some unique and specific problems to the transportation industry. And for the second half of this, we're going to take a little bit of a deeper dive into some of those issues with some national experts to help lead that discussion, and then have a further discussion about what we hope are some solutions that those of you who are dialing in for this can take back to your organizations, and we hope you'll find that useful. So without taking up any more additional airtime, I'm going to segue to Denise to talk a little bit about what her perspective is on the industry outlook for 2021 and what she is seeing as a risk manager in her very large organization, and anything else that she'd like to talk about. So, Denise?
Thank you, David. So, I mean, with respect to workers' comp claims, to me, coming at this from a risk management standpoint, the impact of COVID-19 and how it, really impacted all businesses, particularly frontline workers and critical infrastructure. It's impacted our businesses in many ways. But we're talking about claims today, so I'll try to focus my attention on that. So, year over year, I mean, for 2020, the claims trends have been favorable, as I believe that has been what we have found in other industry publications. As we know, NCCI data, I know one of the questions we're going to talk about is how does this compare to what NCCI is saying? Well, we know NCCI data typically is looking a year previous. So the State of the Line report that was published in May looks back at 2019, and we know that the trends were favorable for 2019. Overall combined ratio for private insurers was 85%. The 6th year in a row with favorable combined ratio, and then the lost time frequency, as we know, has continued to decline. One of the things that sort of was a question for me initially with COVID and our claims is, we had more activity in our stores, both with customers and with employees, providing the necessary services, food, and supplies to the communities we serve. You would have expected to see an increase in claims. We obviously didn't see the decrease in payroll that many service providers experienced, which led to lower claims, people working primarily remotely, which obviously led to a decline in claims. But one would think in the retail industry, where you've got more employees working, you have more activity in your stores, you might see both an increase in workers' comp claims as well as general liability. We didn't experience that, and it sort of begs the question, the degree in which sort of behavior and psychology plays into claims reporting and safety. I think much of what we've seen in claims frequency over 2020 has been the intense focus on safety, and I expect that to go forward into perpetuity. Really, I mean, we're not going to turn back this, really very laser focused attention we have on safety, which has had an improvement in claims, but also has helped us realize, okay, in order to stay open, in order to deal with all of the things we're dealing with the pandemic, it's brought our attention both from an operational standpoint as well as risk management and executive leadership on safety and how we protect the health and safety of our employees as well as the community we serve. So in terms of expectations for 2021, I think we're an industry that is underpinned by projections and studying, actuarial analysis for years. And I really think we're not going to really see and truly understand the impact of 2020 on claims for at least a few years. And I know that there was a lot of hope and sort of wondering what NCCI was going to do with the, rate filing season for 2020 and 2021. And as we know, in the July announcement, there is no changes with respect to COVID-19 rate filing season. So I know there was some concern about that and whether or not that was the right decision. But the truth is, there's a lot of unknowns with workers' comp claims. how this is going to impact us into the future. Most, in terms of frequency, most industry saw those that still were open and had people working, saw an increase in claims, the highest increase in April. And then there was an overall decline. This new third wave, I anticipate we will have even higher increase in claims as it relates to this third wave. But we really don't know what that looks like quite yet. I did, in preparing for this overview, I did look at a study that Oliver Wyman and Marsh is working on, and they're working with well over 100 different employers on that study, and they were looking at claims data, looking at NCCI and other resources like that. We really don't have data on claims yet. And some of the key findings, that their study has found is that, they did see an overall decline in claim frequency. Claim counts were down year over year. There was a modest increase in July, as we saw that increase in the second wave of the pandemic over the summer. And so I would anticipate we'll see that again. Now, the big game changer, as we all know, is the vaccine and what impact that will have on future claims. And obviously hoping to get us back to what we would consider our previous normal, activity. But in terms of the future for our business and other, say, service industries, I think the working from home will not change. I think we'll still have people that are able to work from home will continue to work from home. Obviously, that will have an impact on workers. In terms of retail and transportation, we actually have a very large fleet. The safety practices that have been well embedded previous to COVID and now more of a laser focus so as a result of COVID, I think will continue, which will positively impact claims. I know that Phil Walls is going to talk about the medical aspect and the impact on pharmacy particularly, but I would say from our business, one of the things that has been the silver lining is it certainly has required that we put in place other ways to take care of employees through telehealth services and telerehab, which has required many employers to stand those things up quite quickly. And for an industry that tends to move quite slowly, I think overall the industry has done a very good job with that to ensure we're taking care of employees and providing the services needed. Long-term impact of that on claims, I think, is still not known, as well as the delay in medical treatment that we're anticipating that occurred as a result of many doctors and surgery centers delaying treatment.
Yeah, we can get back to that, I think, especially the telemedicine stuff, because Ann's on and is going to talk about that later on. So thanks, Denise, and hopefully you'll comment further on some of this during the panel discussion. I want to move on to Phil, who's going to give us some additional perspectives on what we can look forward to. So, Phil.
Thank you, David. Now, before we look forward, let's go back for a moment. Denise mentioned the different waves of the pandemic. Let's go back to those early days before the quarantine had even started. There was concern. Our Secretary of HHS had already declared a public health emergency. It wasn't until the quarantine started, I feel, that we really felt the true impact. And what I mean by that, of course, the entire nation had to mobilize a workforce to work from home. So things were happening at a very rapid pace. Information was coming out through all the social media channels, some good, much of it not good. I know as a pharmacist, we were receiving requests on, what should workers' compensation payers do in terms of the formulary when it comes to COVID. We had numerous requests to add hydroxychloroquine to the formulary. And of course, our response was always, no, that doesn't make sense. Even under the emergency use authorization for that drug, it was only approved for use in a hospital setting, never for something that an injured worker would receive through a retail network. So there was a lot of information that had to be clarified, so to speak, based on what was circulating in the media at that time. And early on in the quarantine, myMatrixx parent company, Express Scripts, released a research study that they did called America's State of Mind. And I feel that has significant application today. It wasn't specific about transportation, but it was looking at America and our workforce. And I think there's things in that study that we can tie into our discussion today, especially when it comes to drug therapy. So what that paper was looking at was what was the impact of the quarantine on the use of certain medications among Americans, specifically psychotropic drugs. They were looking at things such as antidepressants, anti-anxiety drugs, and indeed, the quarantine had an impact on those drugs. And myself and some of the other speakers are going to talk about the details of that today. One thing that I want to point out, though, an observation that I made early on, was when we look at the quarantine, and we think about the fact that, okay, all of a sudden, America's workers are being isolated at home via the quarantine. They don't have that social interaction. The results of that research study showed that, the use of antidepressant drugs and anti-anxiety drugs started going up. My thought was, what about injured workers? Not only in regard to the quarantine, but just what about injuries in general? My theory, so to speak, in this is that every time there is a significant injury, and I'll leave it up to each of you to define significant, but basically an injury that ends up making someone homebound, that individual is going through a very similar process to what America did with the quarantine. Only the start date isn't March for everyone. It's whatever the date of injury is for that individual. They find themselves going from being gainfully employed to, in many cases, not employed at all. They're homebound, they're isolated, and unlike the rest of America, when they're going through this, they'll also have access to some very powerful drugs. Not to get into the specifics of that now, because, as I said, all the speakers are going to be talking about different aspects of this, but I feel that injured workers have a very significant, similar plight to what America has seen with this, with the quarantine. When it comes to the transportation industry and the drugs that I mentioned, the same holds true. And so we're going to get into some detail on what it means when individuals are taking more antidepressants, anti-anxiety meds, combining those opioids, then seeing the introduction of stimulants into that therapy, how that's going to affect sleep, and we'll be discussing that in detail as well. So, David, I'm going to stop with that because, like I said, this is a preview of what many of the speakers are going to be talking about today.
Great, thank you, Phil. And we always look forward to talking more about drugs, right? So we'll segue from here. Lori, I understand you and Tammy are going to kind of tag team the next 10 minutes or so. And then we'll have Dr. Percelli wrap up on the transportation specific concerns. So Lori and Tammy, it's over to you.
All right. Thank you very much. Good afternoon. My name is Tammy Reed and I'm with Lockton Company. Everyone joining today. I thought I would start off by sharing some statistics regarding our book of business in the transportation vertical. As I'm sure it's no surprise to everyone that backs and shoulders continue to be the main cost drivers in the transportation industry, the facts reflecting about 19% of both the claim cost and the claim frequency. Shoulder injuries are about 9%, but 14% of the claim cost. In the newly reported claims are down. The upward from about 10,000 in 2019 to about 13,000 in 2020. Litigation appears to be down, and this could be just the impact of, not everybody's working and everybody's scared that they may not have a job to come back to. So although COVID has been a huge concern this year, within the transportation vertical, we haven't seen a huge uptick in those type of claims. The COVID claims account for about 0.5% of all the claims. I know NCCI just recently published that COVID claims were averaging about 38,000 in medical costs. We're just not seeing that in our book of business in the transportation industry. Laura, do you want to talk a little bit about how COVID is impacting workers' compensation claims overall?
Hey, thank you, Tammy. So what is the COVID impact on transportation claims? So I know Denise talked about the waves, and we definitely see the waves. We're looking at 2 waves of COVID disruption. So the spring and summer, and then we got back to normal, or what we could say is our new normal. And then with this increase of cases in COVID, we're entering into our second wave of COVID disruption. So there are delays in recovery process due to elective surgery postponement that we saw. We had delays in doctor's appointments and treatments because offices had to implement COVID safety measures. And of course, we had the employees that just had a fear of infection or did not want to go out to the doctor. But there was an increase. We did see an increase in the telematics to include both doctor's appointments and physical therapy visits. The light duty was affected, so the availability of light duty jobs and the willingness to participate were impacted negatively during our waves. Claim duration increased for us in many cases due to the treatment availability, but also the psychological components. So you have a delay in return to work, and it could be from the desire, a lack of desire from the employee, a fear of returning to work, whether they're going to have a job when they come back, whether they're going to get laid off, or an overall fear of a virus infection by going out and doing their job. And then one component that is new to this is that the potential for child care issues. So you have your child care facilities closing, you have your schools closing, remote learning. So that just adds a whole nother level of anxiety or exposure that the injured worker has to deal with or come back to work. Finally, claim resolution delays. We saw some delays due to the work comp board closures, backlogs, and then also in-person hearings and mediations were delayed. But luckily, many of the courts and the attorneys are now have embraced remote meetings and hearings. So many of the roadblocks or detours that we've seen in 2020 may continue into 2021 and beyond, depending on the ability to eradicate the virus.
So I think some of the things that we need to look for in the future, some of the things on the horizon, I'm sure everybody's anxious to get rid of 2020 and we're approaching the end of the year. But in the upcoming year, I think the challenge will be the COVID vaccine. One of the challenges that we're going to have is the COVID vaccine, and whether or not employers can mandate that vaccine as a condition of employment for new or existing drivers in the transportation industry. There's currently about 48 vaccines undergoing various states of clinical trials and evaluations. Although nothing's set in stone yet, talk of those eligible will first be the healthcare workers, non-healthcare essential workers such as drivers and terminal personnel 65 and older or in nursing homes. Currently unknown is whether or not this will be an annual vaccine or a one-time vaccination. Interestingly enough, a Gallup poll recently was conducted that showed that 30% of those polled indicated they would not take the vaccine, and 50% indicated that they wouldn't if it was developed outside of the United States. So in the past, the EEOC and OSHA are weighed in on vaccinations, and they haven't weighed in specifically yet this year on the COVID vaccine. In 2009, when the H1N1 flu was going around, the EEOC did indicate that employers can mandate the vaccine during a pandemic as long as it complied with the ADA and reasonable accommodations regarding disability and religious objections. However, they recommended that the employers still encourage employees and not rather than mandate that. So I think we need to consider the potential to make the vaccine mandatory, given the widespread nature of the COVID-19 pandemic. But it hasn't occurred to date, and without further guidance from the EU legislators, there's still a lot of unknowns in terms of the mandatory vaccine as we go towards the end of 2020 and again in 2021. Lori, I'll go ahead and pass on to you.
All right, thanks, Tammy. So one of the other things that we believe, 2021 and beyond that we've been looking at is wearables. So wearable or wireless monitoring devices. So wearable devices are increasingly becoming more commonplace. You have your watches and your fitness trackers, but it's not without some concern. So there's concern for electrical overheating, more importantly, or maybe not more importantly, you have your data security and your privacy issues. So, and there was a case study, and there's a lot of case studies out there for these wearables, but it kind of piqued my interest. So 65% claim cost reduction versus the previous year, 62% reduction in injuries versus wearables, with wearables, and then 48% reduction in injuries. So those are numbers that as a risk manager or in the transportation, you look at those and go, wow. But even, it's a case study. So even if you look at a portion of that, this may be something that we really want to look at. So wearables appear to be a part of the future. They can range from a small device on your wrist or on your hip or to a full body exoskeleton system. But some of the areas that they're monitoring is bending, twisting, reaching, COVID-19 exposure. So it can alert the employee or the employee wearing it within 6 feet of if they're within 6 feet of other people. It also can help with contact tracing, stress levels, and as drivers and the transportation fatigue, ergonomics, and posture. So it's a lot of different things that they're throwing out there that this potentially could assist with, and ultimately the claim cost. Very customizable to the companies. So the data can be mined into a central repository, but it can also provide instant notice to the wearer of the device, like a gentle vibration if they're doing something incorrectly or if they're within a couple feet. Now, like I said, it's very customizable. You wouldn't want all the bells and whistles to go out and scare the guy and have him or her hurt themselves. But it's customizable. So wearables could be a part of the safety solution. I don't think it's the silver bullet, but it's in addition to our safety cultures, our safety training, and our communication.
Great, thank you both. And we're right on track for Dr. Percelli to give us her perspectives on some transportation challenges. And Dr. Percelli, over to you.
Hello, everyone. I have a slide deck. Is that up? I don't.
Coming up right now.
Awesome. So to review the trends in work comp injuries in the transportation industry, I pulled Concentra's data from 2019 and compared it to 2020, revealing some interesting trends. What I found was that increased labor demand and limited access to care due to COVID have negatively impacted work comp metrics in the transportation industry. However, common injury groups and key demographics remain the same. Transportation is still a male-dominated industry that trends older than other industries. A 2010 NIOSH study showed that truck drivers are significantly affected by musculoskeletal injuries, with incidence rates of 3.5 times higher than the national average. In 2015, the Bureau of Labor Statistics reported that 1.8 million individuals were employed as truck drivers in the United States. This industry had the highest average cost per workers' compensation claim for all age groups and all occupational sectors. One thing that contributes to this is that driving is notable for being a predominantly sedentary occupation with intermittent periods of physical exertion due to the loading, unloading, and securing of cargo. Okay, the next slide. So we saw statistics similar to the NIOSH study I had mentioned, which revealed, I think another presenter had mentioned, injuries to the arm and back were the two areas most reported by truck drivers. Our stats found that 30% of the injuries were to the shoulder and below, so elbow, wrist, hand, and 21% were injuries to the spine. That included neck, thoracic area, and lumbar area. The average age in the study was similar to our findings at 45 years. We see an average, the truck drivers are about 44 years of age. This compares to 41 in other industries. As mentioned, the common injury groups remain the same compared to 2019, but other trends in the work comp tended to be more negative trends. In 2020, we saw an increased percentage of cases referred to specialists, an increased percentage of prescriptions per injury, and a small increase in the number of visits per case. These stats point to an increased severity, which may have been due to more serious injuries, but it also could have been due to a delay in care or a combination of both. We also saw the physical therapy visits per case increase, and the percent referred to physical therapy also increase. Of note, the physical therapy referral rate in the trucking industry is actually 12% higher than in other industries. We also saw a drop in the percentage of drivers return to regular activity after the initial visit. With the drop in drivers return to regular activity, the offset was transferred to drivers placed on limited duty rather than off duty, which remained, that percentage remained the same. However, the days off duty did increase by 2 days per case. And finally, it's not surprising our case duration increased by 2.5 days. Interesting is that the case duration for the trucking industry is 2.5 days shorter on average when compared with other industries. And this was the same we saw in 2019.
Well, thank you, Anne Marie. And we're going to move into kind of a general discussion for a few minutes on the things that we've just heard. One little amusing thing I have to share with you, Lori and Tammy mentioned the ability to do remote hearings to try to keep some of the legal aspects of work comp moving forward. We learned here in Massachusetts that the chief workers' comp judge had a New York Yankees banner hanging behind him in his office, which did not go over particularly well in Boston. So there's all kinds of things you can learn with remote legal hearings. One of my questions, and this is sort of, I'll throw this out to any of you who want to take it. I was reading today that the American College of Surgeons has a report out that the elective surgical backlog, they believe, is going to take approximately 1 year to clear because of all of the deferred cases. And combined with that, we have an awful lot of healthcare worker burnout and healthcare workers who are being siphoned off to take care of COVID rather than practice their other specialties. So I wonder if during this latest wave, any of you are seeing that in terms of your claims durations yet? Are you seeing difficulties getting care? Are you seeing claims durations increasing? I wonder how well we're going to be able to power through this. So I'll throw that open to whoever wants to comment.
I can start, David, and then if someone else wants to pipe in. I would say that yes, claim durations are longer, but like I believe I think it was Lori that said, I having trouble keeping track of everyone who said everything, but that some of the claim duration issues are related to being able to get in front of the board with settlements. That has been the primary driver of the closure delay. I do think that people that can get care that can be done, via telehealth or telerehab, that care is continuing, and there's obviously going to be some nuances with that, but doing a rotator cuff repair, obviously haven't figured out how to do that telephonically, right? You can't do that through some virtual measure. So, I do believe that will have a longer term impact as those things get pushed further, down. I know that local hospitals, when some of the restrictions were lifted, actually started doing elective surgeries on Saturdays and Sundays just to try to catch up. And I anticipate that physicians will do that again as things change after this third wave. On a personal note, my husband works in orthopedic surgery. He's a first assist, and all of their elective cases have been rescheduled. And but prior to that, as I said, they were scheduling things on Saturdays and Sundays, and anticipated doing that for several months to try to get caught up with the backlog.
I think on some of the smaller cases, I'll just comment on that. I think on some of the smaller, just a sprain strain, the telephysician visits and therapy have helped tremendously. Initially, we noticed that after when COVID first hit, like in March through May, everybody was delaying surgeries, and it kind of picked up and things were getting caught up again, or at least trying to get caught up again. And then with this most recent wave, it seems like things are being postponed again, and they're really postponing those surgeries and pushing them off until after the first of the year.
So what's the, for those of you who have risk manager responsibilities, what are you telling your assistant risk managers to particularly watch out for, or what are you going to do to keep these problems from really impacting your operation to the extent that you can?
I can take that, David, initially. And then, so I would say the primary focus on initially is taking care of our employees. The first and foremost thing is that we take care of our employees. And what does that mean? Ensuring that we've got available partners to provide the clinical care that's needed. We've significantly increased our clinical resources, to partner with our claims professionals, so that as we are helping employees through this pandemic, but also preparing for care and assessing their needs, we have clinicians that are partnering quite closely with our claims professionals to assist them. And I think if there's been any silver lining here, it's that it has underscored the value of clinical expertise and working hand in glove with our claims partners. And I would say to, the typical workers' comp flow and managing a case, we tend to have a very narrow focus. I think the pandemic has, necessitated the need to look at various resources outside of what our normal, approach might be. For example, our claims teams are partnering closely. Risk is partnering very closely with benefits and our health and welfare programs to make sure that things that, that employees can engage available resources and making sure our claims team that are working with employees are aware of, say, our EAP programs or other resources that would be available. So, I think the thing that's most important is making sure that our employees have the care that they need and that we continue to communicate.
I'll just comment real quickly. I think with a lot of the, so many times employers use those volunteer not-for-profit organizations for light duty, and that's become a real challenge during this COVID pandemic also, because there's not as many opportunities out there. A lot of them remove their employees from those resources. For those employees to do to keep them engaged while they recover, while their treatment's being postponed, any kind of, a lot of times in transportation, it's really hard to accommodate them and they just have them doing easy paperwork and things like that. But anything that employers can do to help get them back as much as possible and accommodate some light restrictions to get them back into the workforce helps also keep them.
And I'll just piggyback on to what Tammy said and say one strategy there would be to partner with your, physical therapy providers or telehealth resources to provide, even if you don't have a specific prescription for rehab, but typical things that employees can do at home to make sure that they're maintaining that physical, some sense of physical well-being. So, employees that's sitting at home, giving them very basic exercises or things that they could do at home on their own without any equipment, and keeping them, engaged in their own recovery, I think is an important strategy.
I think those are great points. I want to raise a technical point that no one's mentioned with Dr. Percelli. We've deferred medical certifications for drivers this year quite a bit, and I wonder, as we go further and further into this pandemic, do you see any consequences from that deferral? When we start doing exams again, might we be taking a bunch of drivers off the road at a time when we need them? What are your thoughts about that?
Well, interestingly, I mean, there is a waiver that's out there for drivers to delay their certification. We encourage, however, our clients to keep up on their certifications because, the driver population is an older population. They have more comorbidities, and certainly there's a lot of concern with that and safety. We did anticipate that in June, when the initial delay, when they were going to delay until June, that we would see a bunch of drivers come in, and we actually didn't. So that was good. So hopefully this next, I guess, waiver is due to expire at the end of December, unless it's prolonged. But hopefully we won't get a rash of drivers coming in. Needing their certifications and being delayed. Most of the time it's sleep apnea. That's the problem.
Right, but we will have potentially a crop of newly hired drivers since, some organizations have staffed up, and we may have a bunch of newly hired folks who, are going to have not had a certification for a while. So yeah. Interesting to see what happens.
Yeah, very true.
One of the things that we haven't really talked about, we've talked a lot, or at least most of the discussion has sort of focused on long haul trucking, but remember that the transportation industry also includes municipal transit workers, bus drivers, subway drivers. It includes the airlines. In these industries, lots of bad things have happened, to use a shorthand. And I wonder if return to work is going to be possible for some transportation workers in some of these industries, and whether this is going to create some problems for these industry segments that are perhaps a little different from long haul trucking. Anyone want to care to take that one?
Just to add, and I'll just say that's why I think if you look at the data, we're seeing an increase in indemnity claims and not an increase cost in medicals because of the lack of return to work in the overall claims trends. So,
and this is Lori. I'll piggyback on that, because if they're on workers' compensation, they're getting a regular pay. You have some restrictions in some states, but at least they're getting regular pay. If they come back to work, they might not have a job, so then that all ends and they need to take care of their family. So it's just kind of one big vicious cycle.
Yep, and the sort of elephant in the room there also is some of the anxiety and stress issues, which we're going to dig into a little bit. I don't know if elephant is the right metaphor there, but but we're going to be digging into that a little bit more in a few minutes. I guess the other question is, have any of you, as we've really rolled out telemedicine quickly and in such a big way, and I know Anne, you're welcome to comment here, although I know we're going to be talking about this later, but many organizations were not really ready for remote work. They weren't ready for telemedicine. Anybody have any thoughts about what might you have done differently had you known then what you know now?
Encouraged to choose much earlier, because I think it's worked out well for everybody. I think it has set a lot of employees' minds at ease that they don't have to go into the.
I wondered if in a paradoxical way, the all of the remote medical care has in some sense improved healthcare for transportation workers who perhaps were not connected remotely as well as perhaps they are now. And I wonder if they feel a little bit better cared for in some respects than they might have at the beginning of the pandemic.
I'm sure some do. I mean, you have, and it's easier to get to, so yeah, they can get the attention they need.
Yeah, and it will be interesting to see what the impacts of the increased physical therapy being delivered remotely are going to be on return to work. I have, there are definitely data that indicate that you can do this, but I know that some of the shoulder surgeons are a bit suspicious of outcomes when nobody's put their hands on a patient for a number of weeks after a rotator cuff repair. So it'll be interesting to see long term how that plays out. Moving on with our agenda, I'd like to move to some of the specific problems that really plague the transportation industry. And as some of you have already mentioned, sleep apnea is a big one. And Larry Baird is here to talk with us about sleep and fatigue and what we can do about that. So Larry, it's all yours.
Yep, thanks, David. Leave it to the market development guy to have the most slides, but we'll be able to work through it pretty quickly. It's interesting that apnea was mentioned. We naturally, especially in transportation, go straight to that disorder. What I'd like to do, and just make a point on, we often hear sleep and fatigue used interchangeably, not necessarily this group, but I think as humans and people, when we're talking, we go straight to it. If you look at the definition of fatigue, it runs across the board. Exhaustion, it can be mental, it can be physical. There can be other diseases at root cause. So I think looking at sleep health as a root cause within fatigue risk management is very important. The intention of this slide, I mean, when we talk to people, the nice part about this topic is I don't have a single person I speak with is not interested or doesn't understand the importance of sleep health and their own sleep. And we're going to take this sleep conversation into the topic at hand. Couple of points on this slide. We are certainly getting a lot of pull and interest on the mental health side. The reason that is because it's a correlation that everyone understands. When you're talking chronic condition, diabetes, CAD, weight management, there's a little more research involved and a little more work in making that correlation and association. So the mental health piece is big. Then if you separate the physical health bucket, historically, we've talked about that a bit more. I think the takeaway from this slide with sleep as a fundamental need and behavior for all of us is where we start. There's a short-term, long-term impact here. So if you look at the left side of this, the optimal state of good sleep health, it doesn't take long, it doesn't take many nights, and the impact on mental health, you see a few of them here, the emotional regulation, the cognitive impairment, anxiety and depression. And I think another point is we like to compare sleep health, mental health in the broadest sense, and that's total person. Within each of those is when you have a sleep disorder and a sleep illness, and they're different conversations, but it's important to manage both. I think the takeaway here is there are sustained problems over time. It lends itself, it starts to lead to chronic sleep deprivation and the polychronic comorbidities that we talk about. So let's take this and look at the human factor, as we call it. The problems on the previous slide, whether they're short or long-term mental health or physical health, how do they start to present themselves in all employer markets and in this conversation about transportation? I think the key on the mental health side is that human error. That is unique to people, and it's going to present itself in a professional office environment, a technology environment, than it might in transportation. And we know that, but I'm going to get back to the human error piece because I think it's very important to the topics today. Judgment decision-making, that runs across all functions and all roles. And then obviously you get into performance and productivity. I'm not going to go too deep into the physical health and the chronic conditions, but obviously we spend a lot of our time there. You can rank 7 of the top 10 most expensive conditions and relate sleep to them as an undercurrent or a association or correlation. And more often than not, there's a root cause or medicine and science relationship. I'm going to spend some time on this one for a reason. And as you think through this, I think you look at the sleep component and you think at the work time. So when we look at the task and the daytime, the wake time and the sleep time, all three of these factors come into play. And what do we hear most often? How you sleeping? I'm averaging 6 hours a night. You'll see 7 to 9. You'll see 8 to 10. You'll see people getting under 6. Duration is critical, but that's usually the first place we go. There's another point on mental health here. If you've got a duration situation where somebody is, hyperinsomnia, and you're into 12, 14 hours in extensive napping, that's when you've got to start tying it to mental health. So it's not just short nights, it's long nights and sleeping excessively. Timing is the one, and there are two components to it. On the sleep side, for me personally, the timing is the critical component of these three. When are you sleeping? What's your sleep structure? What's the sleep architecture? So is it consistent? And if you're 10 to 6 on the weekdays and that shifts to 2 to 8 on the weekends or 2 to 10, there's a problem with that consistency. If you look at it from a work perspective, what we'd say work time, you get into shift work, you get into disrupted schedules, which is more prevalent than ever right now. And then you're battling sleep time and wake time. An example, my prior role at a global beverage company when I was in product supply, we started seeing, and here's an Albertsons example, it goes right to it, not specifically, so night deliveries. So the delivery cycle became more of a 24/7 operation. It didn't grow total demand. But because we didn't have perpetual inventory and a true demand signal, we took the same labor pool and the same amount of drivers and spread them all out against a different need at different times. So now you've got a bulk driver delivering at 2 in the morning. What's happening the next day? They may run a regular hour. So their 10-hour time off becomes very challenging. Quality, apnea is a great example. I was a sleep sufferer before I came into this role 6 years ago with ineffective treatment of apnea. And apnea is a condition where you can, from the time you fall asleep to wake up, you can get 9 hours of sleep and feel like it's terrible. Your health suffers, but the duration seems fine. So the quality piece, and if you tie it to transportation and some of the changes, you can take 2 hours off duty, get your in the birther unit, get 2 hours of sleep, and it's going to count towards your 10 hours time off. What we want to make sure of is if that's 2 hours and that's the reality of the job, that there's quality there. So when people are sleeping, the quality becomes very important. If you tie that back to wait time, what does the daily task look like, both in their personal lives or in the workplace? Is it arduous? Back to your timing schedule. So these intertwine very closely and are well connected in how time is managed, both on the job and from a sleep perspective. When we work with clients, there's focus on shift work. There's a demand sometimes, the manufacturing environment. How do you manage a 12-hour shift? Is it a 5-10? Is it a 4-12? What's optimal? And we often skew to the business, and naturally so. What are the demands of the business? And increasingly we're seeing it. And it's so important that we look at the human factor. Because if I'm a driver and I've got issues, some sort of sleep health issue, it really doesn't matter how you manage my schedule if I've got an undiagnosed or poorly treated sleep condition. So those two play together, and the DTQ is really a building block where we start. So I'm going to bring human error back into this, and we're not going to go too deep into the health conditions because we could talk about that for days. What are some ways we can start to create markers within compensation, within disability, and in this case, preventable accidents? So less about the results here, but more about 2 ways we can identify sleep's impact, and it's driven by human error. These happen to be two clients with transportation segments. I will tell you the one on the left is 8 years of history. I didn't trend that one out, but when you do trend it out, the initial impact, and when I came in from my prior role, I almost couldn't believe the results and the outcomes. So incident accident, and this is an 8-year history. As you trended out, which I don't have here, you saw a significant impact of those being treated for, in this case, sleep apnea, versus those with diagnosis claims for apnea that hadn't been on this particular model, this business model, provider model. Those numbers are encouraging because they're both decreasing. And over time, you saw that delta close because other safety measures were implemented. Vehicle telematics, lane departure. This particular client, a very comprehensive and robust program that ultimately achieved what they wanted, with sleep being a key part of it. The other is a 5-year trend, and this is a transportation company. This cohort research is tied to, for driver populations, we'll use de-identified claims data and look at diagnoses, testing, and treatment for sleep apnea outside of this program. And this is the business piece of it, but the blue there are the participants that happen to be working under our behavioral sleep health program. The others are those that have shown diagnoses with apnea, but really it's not about who's treating as much as it is visibility. You know, in the claims, you're going to see apnea and maybe a 2% prevalence. We know that's way off. So it's not as visible in the claims data, just in apnea. And if you look at the other conditions, certainly even more so. But this looks at a visible population in the blue, and then it starts to look at a green population where we know there's been apnea diagnosed and potentially not tracked and not visible. And that's an inherent flaw in the way we manage and treat it. Off of this slide, I'll stay on the human factor piece. If you go in a manufacturing environment, jumping off, we did some Lean Six Sigma research. So where would you expect that to show? Errors and defects. So when you get in the workflow, when you get into OC Health and you tie in human error protocols, OSHA regulations, there's important impact on the sleep front. I'll leave you with this, and I mentioned apnea earlier. It is a serious health condition. Obviously, it's taken on importance. Back a decade ago when we started, it was an apnea focus, and we operate virtually anyway. And a lot of that was due with the regulatory environment, and still is. The way I like to look at it, go back to my first slide, a short-term issue with sleep, 2 nights of 2 hours, 1 night of 4 hours, we wouldn't want that driver on the road. So it is, apnea as a disorder needs to be addressed. So does insomnia, so does restless legs, so does circadian rhythm, and so do short-term issues that may be a bidirectional relationship with mental health. So if someone is tired and it impacts their fatigue, sleep health in the broadest sense needs to be discussed and addressed. That's kind of a key takeaway.